On this Monday night, new alarm in Ontario. Schools shut down and hospitals struggle to free up space.
We really have no bed.
Dire days ahead as Canada now fares worse than the U.S. in daily case counts. Alberta's premier defends his pandemic protocols.
Abstract political principles don't stop people from piling up in intensive care units.
As COVID fatigue and frustration rises across the country. Another black man in the U.S. killed at the hands of police. The officer says it was an accident. And observing Ramadan in a pandemic.
Islam is a very social religion.
How Muslims in Canada are adapting tradition.
Global National with Donna Friesen.
Good evening and thanks for joining us. Evidence is mounting what a dire situation some provinces have reached with COVID-19. Today, Ontario announced schools across the province will move to remote learning for an indefinite period to try to limit the spread of the variants. They're still winning the race with the vaccines. And Canada's trajectory right now is worse than our neighbour to the south. Back in January, daily cases peaked in both the U.S. and Canada. Since then, they've been dropping in the U.S. and rising in Canada, which is now outpacing the U.S. on a per capita basis. Yesterday, Canada reported more than 223 new cases per 1 million people. The U.S., 211. 6 of Canada's provinces are leading the way. Alberta has the most active cases per capita now at 323. Ontario isn't far behind with 223. And more than 4,400 new cases were reported in Ontario today, adding to the already enormous strain on hospitals. Record numbers of COVID patients need intensive care. Hospitals in the Greater Toronto area have been told to close their pediatric units to free up space and staff. Elective and non-urgent surgeries are being postponed. And that may not be enough. The situation in Ontario hospitals has never been more dire. Mike Drolet has our top story tonight.
For months, Ontarians have been warned a third wave of COVID-19 could be the worst one yet. And there's no denying the rise in ICU cases. Over 2/3 of the over 600 patients in hospital are on ventilators, leading to the difficult decision to cancel all elective surgeries.
It's the right decision. Right now in our hospitals, we really have no bed.
That means only emergency surgeries for things like heart attacks or trauma will continue. Joint replacements, cataracts, even cancer surgeries have been put off until the COVID cases decrease, leaving patients with chronic pain at home waiting. Beth Perfect, who suffers from debilitating back pain, had been bumped to the top of the list for spinal surgery.
Just over a year ago, I started to get radiating leg pain that's extremely intense, and that radiating leg pain has become unbearable.
She got the call last Friday. Her surgery was on. 2 days later, another call. It had been canceled.
It's overwhelming how emotional it is. It really is a roller coaster of emotions because there isn't any relief from the pain, but the thought that a surgery can make that pain go away and then to have that sort of snatched from you, you know.
Ontario has yet to make up for the surgeries canceled during the first wave, and the backlog of over 250,000 surgeries could take years to clear up.
It's going to be a very long road, and trying to just as quickly as we're revving down, we also have to appreciate how much work and effort it's going to be to rev services back up and try to catch up with all those canceled surgeries.
Many of the doctors and nurses who perform those surgeries are currently working in ICUs with COVID patients. The system, say healthcare workers, is straining to keep up.
I mean, if the alarms have not been sounded, like by this point, maybe this will sound the bells for people to really understand what's going on, because I can tell you it's getting frustrated when people are complaining about schools being closed and businesses being closed and restaurants being closed. Like, I think people really don't understand the situation that we're facing.
Given the rise in new cases, not enough people do. Mike Drolet, Global News, Toronto.
Late today, the Ontario government announced it is reversing course and switching schools right across the province to online learning after the April break. Premier Ford was asked why, for weeks, he resisted calls to put tighter restrictions in place to stop the spread. This is part of his answer.
It's easy, and I'm not saying you, Rob, but it's easy for people to sit back and say, should have, could have, would have, done this, done that. Walk a mile in someone's shoes. It's never the Premier or Doug Ford sitting in some corner making a decision. There's hundreds and hundreds of people that are part of every single decision that we make down here.
Alberta has the highest rate of active COVID-19 cases in the country right now. Still, Premier Jason Kenney is defending what he says are some of the least stringent COVID-19 restrictions in much of the Western world. He is facing pressure from within his own party to loosen protocols even further.
I would say we have tried to take a balanced approach because of our Alberta belief in freedom and personal responsibility. But abstract political principles don't stop people from piling up in intensive care units and threatening the limited capacity of our healthcare system.
Alberta's latest modeling projects there could be 2,000 new cases a day by the end of this month. That could result in 500 to 600 people in hospital. There has been frustration and anger in Alberta with the restrictions, but nothing like the vandalism in Montreal last night. Hundreds turned out to protest the curfew, and some escalated things, starting fires and breaking windows of businesses that are already struggling. Mike Armstrong reports on the mounting frustration.
This is the aftermath. Up and down the streets of Old Montreal Monday morning, crews were outside repairing broken glass, while inside, staff was trying to clean broken glass off of everything.
This was just pure acts of violence, and it's my neighborhood, so I'm really concerned about it.
Now, it started as a protest. The Montreal region's COVID-19 curfew was moved earlier Sunday night from 9:30 p.m. to 8. The crowd stayed out.
There are people on big microphones screaming La Liberté.
By the time it was over, police handed out more than 100 tickets for violating curfew and arrested 7.
It is not acceptable. Don't attack people that are already suffering.
We're not wanted here.
Now, there have been protests since the beginning of the pandemic, but after close to 14 months, frustration may be growing. This was Kentville, Ontario last week, a group gathering at a restaurant that was supposed to be closed.
Canadians are free.
Those same frustrations were out in force outside Edmonton Sunday. Alberta Health Services had ordered the Grace Life Church closed and fenced off after it flouted the rules for months. Protesters at one point tried to pull the fence down.
The government is trying to destroy the family and the church.
Health officials across the country are having to battle frustration on one hand and misinformation on the other. The goal is to get people to follow the rules, to hang on for a couple more months when vaccinations will have an impact. The problem is getting that message across.
We just need to make them understand this bug is not the same bug as last year. This thing is very infectious. It attacks everybody.
The biggest challenge may be the finish line. It's already moved over and over, and COVID-19 fatigue is to be expected. It's also something that could cost lives. Mike Armstrong, Global News, Montreal.
Cases of COVID have spread so fast in Canada's most popular ski resort, Whistler, that the province closed it down. Now the focus is on vaccinating everyone over the age of 18. Gill explains the rollout and what it's hoped it will lead to.
Whistler has always been a favorite destination for tourists. It now has an unfortunate reputation as one of the country's COVID-19 hotspots. That's why British Columbia's immunization campaign is focusing on this resort community of 13,000 people. And the relief is palpable.
We're a pretty high-risk town, so I think it's about time that we've got it.
This part of Canada has been a vector for the variants of concern. For months, the more contagious mutations of COVID-19 hitched a ride with travelers from other parts of the country. They then spread to British Columbians who were also vacationing in Whistler.
We feel that we're at a place now where we've got to get better containment of this surge.
Between January and April, the community recorded more than 1,500 cases fueled by these variants. Modeling experts predicted this spike and warned the province to expedite the shots for essential workers who have high rates of transmission.
You have to treat this variant of concern as a harder curve to bend down, and the recent restrictions are bending it down a little bit, but not enough to avoid the surge in cases.
It's like a new pandemic. It's like a new kind of virus that's a lot like the other virus. It's like its child, but it has more transmissibility, and that means what we were doing before, it's great, we're doing all the right things, but maybe we weren't doing them strictly enough.
But BC's public health officer is keen to stick to the original plan.
Every person that's immunized
protects all of us. So we all need to focus on that right now, on getting these hotspots taken care of, because that protects all of us as well.
Whistler did get shut down, abruptly ending the ski season. The hope is the vaccination drive will help allow tourists back in its summer season.
It's an opportunity for us to turn our minds towards summer and know that we'll be able to really provide a safe experience and that our community will be protected.
There are few travel options in this pandemic. Whistler may be one of the few destinations for Canadians if the virus can be contained. Robin Gill, Global News, Vancouver.
Doctors at Toronto General Hospital have performed something historic, the first double lung transplant on a COVID-19 patient in Canada. 61-year-old Timothy Sauvé from Mississauga was in good health before he caught COVID at the end of last year. It ravaged his lungs so severely, the doctor who performed the surgery says a transplant was the only option.
His lungs had the same type of injury and destruction as we see in many of the patients that we treat in our ICU. And the lungs, even after having significant injury, they can recover to a normal or near normal function. So we only consider for transplantation or patients that we're fairly certain that that lung won't get any better. And that's the way that, or the only way that that patient can be saved.
The operation was in February and Sauvé is recovering well. The federal government is bailing out Air Canada. It has agreed to give the airline $4 billion in repayable loans, and it is taking a $500 million equity share in the airline. As a condition, Air Canada has agreed to pay refunds to Canadians who had their flights cancelled because of the pandemic. That money will come from another $1.4 billion loan provided by the government.
The real key criteria is when you booked your flight. So you will have refunds available for travel that was purchased on or before March 22nd of last year for travel after February 1st of last year that was canceled either by the passenger or by the airline. And then refunds will also be available for flights purchased after March 22nd of last year, but where the airline canceled the flight.
Those refunds are promised as soon as possible, beginning April 30th at the latest. Air Canada has also agreed to keep a minimum of 15,000 people employed, limit executive compensation, and resume service at 13 regional airports that had been halted because of low demand. While the rest of us are longing to go on vacation somewhere, almost 200 Dutch people are sunning themselves at a 5-star resort in Greece, and it's all backed by the government.
Playing some games, drinking a cocktail and stuff.
The 8-day Greek getaway is a test to see if safe holidays are possible. The tourists are confined to the resort where they are the only guests. They can use the pool, restaurants, and other facilities, but not go to the beach.
Very happy. Been a long time since we've been on holiday. So let's see if we can enjoy it, even with the restrictions we have.
They need to take COVID-19 tests during their stay and after they get home, where they'll have to quarantine for 10 days. Despite those restrictions, about 25,000 people applied for this trip, which is costing each person about $600. A big day in England. Pub gardens reopened for the first time in months. No indoor dining or drinking is allowed, though. Retail shops, hair salons, and other non-essential businesses also reopened today. The Prime Minister calls it a major step forward on the roadmap to freedom. Some restrictions are also being eased in Wales, Scotland, and Northern Ireland, though on different timelines. The tight restrictions and rapid vaccine rollout has brought new COVID-19 case numbers in the UK down to 22 per 1 million people. Across Britain, 48% of the population has now received at least one vaccine dose. In Canada, it's about 19%. Prince Harry is back in the UK for the first time since that Oprah interview. He will reunite with the family at his grandfather's funeral on Saturday. In a statement today, Harry said the Duke of Edinburgh was a man of service, honour and great humour. He was authentically himself with a seriously sharp wit. Harry says his grandpa was master of the barbecue, legend of banter, and cheeky right till the end. Right now, he would say to all of us, beer in hand, oh, do get on with it. Harry's wife, Meghan, who is pregnant with their second child, is staying in California. Harry's brother William also paid tribute to Prince Philip today, releasing this photo of him with his great-grandson, Prince George. William says his grandfather's century of life was defined by service to his country and Commonwealth, to his wife and Queen, and to our family. He says he will never take for granted the special memories his children will always have of their great-grandpa coming to collect them in his carriage. An investigation into military misconduct shut down. Coming up, why one of the hearings is ending. The Canadian military has been facing an institutional crisis over allegations of sexual misconduct among its highest ranks. The House of Commons Defence Committee has heard hours of testimony trying to determine who knew what, when. Now, one of two parliamentary investigations is being shut down. Our Ottawa Bureau Chief Mercedes Stevenson is following the developing details for us.
Donna, Liberal MPs backed by the Bloc Québécois have shut down hearings into military sexual misconduct by senior brass. The vote means that key political staff from the Minister of National Defence's office and the Prime Minister's office will not be called to testify about whether the Prime Minister or his Chief of Staff were aware of allegations against General Vance in 2018. Conservative and NDP MPs say hearings are being cut off before answers, accountability, or an apology have happened.
What we're trying to do is give confidence to Canadian women that they can serve equally in the Canadian military. And that confidence comes only when they know that these issues will be taken seriously at the very highest level. We have not concluded this study, and we still have additional witnesses to hear.
We still have no answer on why a CDS with outstanding unresolved sexual allegations of sexual misconduct was allowed to continue in his position.
Liberal MP Anita Vandenbeld says committee has to wrap up hearings now in time to write a report with recommendations to be delivered to the government before the summer recess. A prominent advocacy group for victims of military sexual trauma called It's Just 700 say parties are playing politics at committee and they want to report an action as soon as possible. However, other victims are furious that the hearings are ending now. Donna?
Mercedes Stevenson in Ottawa, thanks. Fury in Minnesota again. Another black man is killed by police. Ahead, we'll show you the police body cam footage. Police in Minnesota say an officer who killed a black man in a Minneapolis suburb made a fatal mistake. 20-year-old Dante Wright was shot during a traffic stop. It happened not far from where George Floyd was killed. And a warning, this story does contain disturbing images. Police released body cam footage showing the moments that led to the fatal shooting. They say the officer intended to use a taser, but fired her gun instead. As Jackson Prosco reports, the incident has reignited tensions in a community already on edge.
He'd been pulled over for expired plates and an air freshener on his mirror, and when police discovered an outstanding warrant, they tried to arrest 20-year-old Dante Wright. The officer's body camera video shows Wright appeared to try and get back into the car. He drove a short distance before crashing the vehicle and later died.
It is my belief that the officer had the intention to deploy their taser, but instead shot Mr. Wright with a single bullet.
An accidental discharge, according to the chief. Wright's mother spoke to her son just moments before that fatal encounter.
Said he was getting pulled over by the police. And I said, well, why did you get pulled over? He said they pulled him over because he had air fresheners hanging from the rearview mirror.
The officer involved is on administrative leave. That apparently fatal mistake has led to calls for her to be fired immediately.
I do fully support releasing the officer of her duties.
In this suburb of Minneapolis, the death of another black man at the hands of police touched off a night of protest and sporadic looting.
Come out now!
Police and the National Guard responded with tear gas and an overwhelming show of force.
At this time, I am requesting, again, sequestration of the jury in view of the incidents of last night.
Not far away, at the trial of former Minneapolis police officer Derek Chauvin in the death of George Floyd, the defense asked for the jury to be sequestered, fearing news about Daunte Wright could impact eventual deliberations.
I'm going to deny the motion to sequester the jury and for additional voir dire.
Chauvin's fate could be in the hands of that jury within a week. Answers for the family of Daunte Wright could take much longer. Police say there will be a full investigation into whether this was truly an accident, with the police chief in this traumatized community suggesting it's unlikely the officer involved will ever return to duty. Jackson Prosco, Global News, Washington.
Next, Muslims in Canada prepare for a second Ramadan in the pandemic. There are plenty of things we miss these days. Gathering together with family and friends probably tops the list for most people. Celebrating and observing religious traditions has been so difficult. Muslims in Canada will begin to mark the holy month of Ramadan tomorrow, limited by restrictions for a second year in a row. And as Heather Yurex-West explains, gathering after sunset will be especially difficult in Quebec.
For Patricia Clifford and her family, Ramadan is a special time of year, even if COVID restrictions are limiting how they will be able to mark the holy month.
We have chances to go into the mosque, but again, staggered. We do have to do appointments with it, and that's okay. You make do. Human beings, we're adaptable.
Muslims spend their day fasting during Ramadan, coming together at night to share a meal. But in many parts of Quebec, the curfew means no one can leave their homes after 8 p.m.
For us, basically Ramadan is three main things. Number one is fasting. Number two, special prayers. Number three, sharing the meals with the ones who are lonely and who are hungry. And this year, because of the curfew, we are losing almost all three of them.
Islam is a very social religion.
To help foster a sense of community, Ahmadiyya Muslim Jamaat Canada has planned a series of virtual Ramadan events so people can gather online.
Every day there will be programs, lectures, sermons, so that, they can at least feel virtually as a community.
With variants of concern driving exponential growth of COVID-19, medical experts are urging Muslims to be especially cautious.
Ramadan is not a one-day event or a weekend event. This is something that goes on and continues for an entire month.
It's why Calgary's mayor plans to stay safe at home.
Ramadan is a time for us to remember community and a time for us to remember charity and how we look after one another.
And so once again, Ramadan gatherings will be quiet in Clifford's house as they look forward to a time when everyone can come together once more.
I keep saying inshallah, which means God willing, that this won't last for long.
Heather Yurex-West, Global News, Calgary.
And that is Global National for this Monday. I'm Donna Friesen. Tonight's Your Canada is the Bedford Institute of Oceanography in Halifax. Please send us Your Canada to viewers@globalnational.com. Thanks for watching and hope to see you here again tomorrow. Take care of yourselves. Bye-bye.